context on the climate change impacts of British Columbia. So scientists agree that greenhouse gas emissions are the major contributing factor to changes in global and regional climate systems. And furthermore, we know greenhouse gases can stay in the atmosphere for tens of hundreds of years. So even if emissions were to end today, the planet will continue to warm for decades to come. And what this means for British Columbia is we'll experience warmer temperatures in the range of 3 to 5 degrees, changes in precipitation patterns with less summer rain for the southern and central BC, more for northern BC. There'll be changes in our ocean parameters, including temperature, pH, and oxygen concentration. There'll be a rise in sea levels of about 80 centimeters in Nanaimo and 120 centimeters for the frozen delta. And there'll be an increase in severity and number of extreme weather events, including flooding, storms, and wildfires. So what does that mean for the health of British Columbia? Well, with warmer temperatures, we're going to have reduced air quality caused by a raise in particulate and pollution. This will lead to exacerbated cardiovascular and respiratory illnesses for individuals. There'll be increased levels of pollen, which could lead to an increase in prevalence of asthma. There'll be extreme weather events posing direct health risks from injuries and death, from flooding, storm surges. Oh, is it not on?
Sorry. Sorry for repeat all of that. No, they heard you. You're good to go.
Okay. Extreme weather events. Okay. Because my voice started shaking. I'm like, oh, I can't go back. Okay, great. Extreme weather events, yes, pose direct injuries and death from flooding, storms, wildfires, contaminated food and water supplies. Higher temperatures and changes in precipitation will affect breeding grounds for diseased hosts and the adaptation and importation of vectors. This will lead to an increased risk of the spread of infectious diseases. So the entire population of BC will be affected by climate change, but some groups will be more severely impacted than others. The most vulnerable groups, of course, will be those that are already disproportionately impacted by the social determinants of health: elderly, children, First Nations group, and especially those living in rural communities. Now, governments and sectors are taking measures to mitigate climate change through the reduction of through the implementation of greenhouse gas reduction targets and sustainability initiatives. However, the public health sector will still be required to adapt in order to be able to respond to the impacts of climate change. So, unfortunately, that paints a rather bleak picture, but it does become more positive now. So the objective of the work that I did was to research and compile a list of local resources that include research, programs, initiatives, organizations that are making those connections between health and climate change here in BC, and that could potentially be used for enhancing the capacity of the public health sector by program and service delivery by BC Healthy Communities. So resources were collected through a literature search, internet search, and key informant interviews. So in total, 25 local resources were compiled within these 6 themes that I've highlighted here. So for the sake of time, I'm just going to highlight a couple of examples. So within the theme of education, one resource was NextGenU. NextGenU is an online portal that's 100% free, fully accredited, higher education and health sciences. It's available to everyone. It's an online course that's developed through partnerships through organizations such as universities, the US CDC, and the World Health Organization. And one of the courses they offer is Health and Climate Change. Under the theme of climate modeling, a resource was Pacific Climate Impacts Consortium and the Plan to Adapt tool. This tool allows for the generation of maps, data, plots that can describe the projected future climate conditions for regions within BC. So a useful tool for long-term planning by health authorities and local governments. So there are resources available, though they are limited in number and tend to be very focused. There were no local resources that spoke specifically to how to enhance the public health sector or what exactly will be required for adaptation. Now, having capacity implies having the knowledge, resources, and the authority to act as the conditions dictate. However, having sufficient resources such as staff, time, and budget have been cited in research, including that done by BC Healthy Communities, and from the key informant interviews I did, as challenges in being able to move forward in addressing climate change adaptation. I sound like I'm going to cry. I'm really not. I think my mouth is just very dry. Okay, so I know, breathe. That's why I brought my water to 4 sips, but time is ticking too. So one recommendation is for the creation of partnerships. So what I've highlighted here is 4 key areas along with associated programs where opportunities exist for the creation of partnerships. So within the theme of knowledge enhancement, in the context of the public health adaptation to climate change, this refers to understanding the climate science, understanding the impacts of climate change, as well as including conducting vulnerability and health impact assessments. So the opportunity exists within the public health sector itself for developing a process for combining health impact and environmental impact assessments. Within the theme of education, education could be focused on 3 primary groups: the health sector, policymakers, and the public. This will enhance the capacity not only of the public health sector, but of the entire province. One example would be for the public health sector to partner with school boards to ensure environmental and climate change curriculum are part of the education system. This would target our future environmental stewards, voters, as well as connecting with their parents. Monitoring refers to climate modeling, disease tracking, and the implementation of early warning systems. Partnering with climate scientists on regional long-term climate modeling programs would allow the health authority to better be able to plan for and have interventions in place prior to worsening conditions. Advocating refers to advocating for healthy policies as well as system changes. A partnership approach for the creation of policies will help to ensure that policies do no harm to vulnerable populations and instead provide health benefits for all British Columbians. And I won't say anything about system changes because I think Damien did such a fantastic job of that this morning. Now, another challenge experienced by the public health sector in adapting to climate change is that connections between health and climate change are often not well understood or explicitly stated. This can make it difficult for the public and policymakers to understand what work is being done to address the health impacts and what future work needs to be done. We've heard about climate change and global warming for decades, but it's been very often framed in the context of the environment. And in this way, individuals are often left with the perception that climate change is only connected to the physical environment and something that's occurring in a distant time and place. So it's important that we take the opportunities to make the connections between health and climate change through the use of a health-centered approach and by appropriately framing and clarifying the health components and policies and programs. A very useful tool we have at our disposal is the way we tell the story. Telling the story brings awareness of the impacts of climate change and the work that is being conducted. One method is to use storylines of the local health impacts due to climate change in a way that is similar to conducting emergency response scenarios. Telling the story can highlight a community's vulnerabilities, as well as provide a visualization for policymakers, planners, and the public to understand. Also, when we speak of climate change, it's important to provide empowering messages, making sure we leave people with the knowledge of the actions they can take. The topic of climate change can leave people with a sense of hopelessness, and this lends itself to inaction. Keep messages simple and empowering. As well, make sure you know your audience, their level of education, their concerns, their views on climate change, and their cultural views. So, just before I wrap up, I just wanted to leave all the current and future public health professionals with a few tips. Continue to seek education. One option was the Next Gen U. Another option is a webinar series put out by Pacific Institute for Climate Solutions. Take opportunities within your workplace to communicate about climate change. Identify the health and climate change connections, how your organization may be required to adapt, and identify the vulnerabilities. Connections between the work you are doing and climate change may not be readily apparent, but they are there, and it's not the job of any one person or department to plan for adaptation. As one informant stated, individuals often get caught up in their job descriptions and departmental mandates. This makes collaborations challenging and opportunities are missed. Assist in making climate change an action, or assist in making action on climate change a priority in your workplace. Talk to leaders about it, and that's my time, and ask for it to be added to agendas. At this point, there still remains more questions than answers, but starting and continuing the conversation is a great first step. So my thank yous, BC Healthy Community, Climate Action Secretariat, and the health authorities, along with Carrie Tyler, Sally McBride, and Dr. Erica Frank, all my professors, Victoria, Catherine, Michael, and Trevor, and to my best friends, Vasco and Nicole, for their unwavering support. Thank you.
Okay, breathe now. Breathe.
I just, the mouth dried up, everything.
Okay, questions for Catherine on that very cheery topic. There's one in the back over there.
One at the back, yes.
Yep, over on the other side. While they're doing that, can I ask you a quick one?
Yes,
Can you
absolutely.
give us like a little vignette of the kind of a story you might target to a particular audience? Just like 2 sentences. What would the messaging be and to whom?
Oh, geez.
Okay, if that's too hard, never mind. You can tell me later. I'll go over there.
I would love to target leaders, first off. In 2 sentences, what I would tell them, I'm not quite sure yet, but they would definitely be my starting
You
place.
said you were used to doing elevator pitches, so I thought maybe. But anyway, go to the question.
Thank you, Catherine. I'm wondering, what do you see the role of denial of climate change in communications plans?
What do I see? To be honest with you, at this point, I don't think. It's very interesting. You know, Damien put that slide up, the hope and the pessimist, and I would definitely let myself in with that. At this point, I'm all for inclusiveness, having a full debate. Personally, I think we're past debating. Climate denial, you can continue to do climate denial, but the climate will keep warming, and we have to keep moving forward despite individuals who don't believe that it's happening. That's my honest answer. Yes, which I know doesn't quite align with the cautious approach to public health, but yes.
Any other questions?